Hi everyone, welcome to another webisode of The Good Doctor. Today's topic of conversation is about diabetes and how it affects two vital organs, your leg and your kidneys. I'm here with Dr. Amit Kumar. He is a specialist in vascular and endovascular surgery, and he's also an assistant professor at Columbia University. Welcome to The Good Doctor Show.
Thanks very much.
So, vascular problems that relate to the leg. Let's talk about that first. How does diabetes impact that part of the body?
So we all know how frequently diabetics are seen in all of our lives. Physicians especially are seeing a lot of diabetics, and what happens is your sugar's too high. That's the bottom line. And when the sugar's too high, it goes and gets stuck to things. And the most important thing that gets stuck to are your blood vessels, right? So it's like a piece of gum stuck to a straw.
Okay.
Now what's happening is that piece of gum is both on the outside and on the inside. So as a result, there's not enough blood flowing through it. That's the same problem that affects the legs, and that's the same problem that affects the kidneys. In the legs, when this sort of thing happens, you call it diabetic foot, because the foot's the furthest part of the circulation and that's what gets affected. Or it can affect the kidneys, in which case you'll have kidney problems. So that's when you start talking about this word called dialysis.
What happens? Are there visible signs where you can, you see your leg? Does it turn purple? Does it change color? Does the blood vessel sort of rupture, or what happens? What
happens is that the blood vessel gets blocked.
Okay.
As a result, there's not enough blood going down. So think of it as a famine that's happened when there is a dam that has been built upstream and not enough water is going down.
Right.
And so in that context, not enough blood going down causes things like pain. It causes things like you have an ulcer, and that ulcer is like a wound that happens in the leg and it just doesn't heal.
Right.
Or you can have nothing like that, and the first sign that you'll see will be the blackish discoloration of gangrene.
Wow. And what are some of the cures or some of the solutions that are out there that can remedy this?
We live in amazing times now. In the old days, what everybody used to be offered was an amputation.
Right.
Get the leg cut off and you'd see people walking around with a prosthetic on their leg.
Right.
Which is not needed in most of the cases. In fact, the sad part is that right now, even in this day and age, there is an amputation being performed every 30 seconds in the world.
Related to this disease, illness?
70% of these amputations are in diabetics. So what's amazing now is that by using catheters and wires, you can open up almost the entire circulation. Patients don't have to stay in the hospital. They come in, they get the procedure done, they go home the same day, regardless of if it's a gangrene. Unless, of course, you have a lot of infection that requires separate treatment. But for the most part, blood vessels can be opened up as outpatients, as day surgery, and you're able to send them home the same day. And you can see the results remarkably quick. How
does diabetic affect the kidney?
Same problem, circulation's getting stopped. Not enough blood going to the kidneys start developing high blood pressure to try to improve the blood going through. So for example, if a door is blocked, what do? You put a shoulder on the door to try to open the door.
Right.
And so that shoulder, that force is the blood pressure that you're seeing. And that affects things like it causes strokes, it causes kidney failure. And so again, simple solutions for these problems. Everything is through catheters and wires.
Right. Now, when we talk about illnesses, sicknesses, diseases, things that affect our body, we usually look at it in isolation in terms of the illness to the individual. But these also have community and family impacts as well. What are some of your thoughts on this regard?
You're absolutely right. The biggest impact is actually on the family. So think of this, a person who's on dialysis. What does dialysis mean? That he has to get the blood cleaned every 3 days, typically, in the hospital. So somebody has to take the person, take them to the hospital. He spends about 4 to 6 hours hooked up to a machine, then has to be brought back. So think about the transport. And it's not a simple person, because they're not always walkie-talkies. There are people sometimes who are wheelchair bound. Right. So you need special transportation for them. When they come back, they're completely tired. And so again, the needs of that person. So somebody else's life is completely changed because of this person being on dialysis.
Right.
And that's why dialysis itself is such an important thing. Why? Because you want to minimize the visits to the hospital. The 3 times a week that I've told you is only for the dialysis. What about making the process for which you can get hooked up to the dialysis machine, which is called a fistula, or a catheter. If you get an infection, if it stops working, all these things. And that's why it's critical that you get these things done right the first time, because every time you go back to repair a car, it's not the same thing as a new car.
So how does a patient know when they need to come and see you or a specialist when it relates to diabetes that affects the leg and the kidney?
Simple answer, any person who's a diabetic needs to see a vascular surgeon when he's diagnosed with diabetes. Why? Because they're on, the ball is set rolling to say how often you will see the vascular person for either your kidneys, your legs, your carotids, many other aspects that are impacted that we haven't touched base upon today in diabetics. Get diagnosed with diabetes, see a vascular endovascular person. That's what my suggestion is. And then let that physician therefore decide how often you need to be seen.
One of the questions that comes to a patient's mind that has diabetes and they're looking for a facility, how do they choose the right facility that can take care of them?
You know, to take care of a diabetic patient from a vascular perspective, you need several things. You need to, of course, have a clinician who's trained in both open and minimally invasive surgery. You need to have a facility that has the ultrasound imaging. Now, ultrasound for vascular is very specialized. It's not something that you can say, just get done with any person who can do an ultrasound. It requires special probes, special ultrasonographies, equipment to be there. After that, you need to have a place that you can do some of the catheter related stuff, and you need to have a place that can do open surgery.
Right.
So these are the things that you need to look at. Why? Because only centers that offer comprehensive treatment can offer you honest treatment. If they don't offer one or the other, they'll try to push the other aspect to you, and that's just not good medicine. It comes back to bite the patient, it comes back to bite the physician who's going to be treating you for the complication that you're going to be having. So my suggestion to the viewers, look for comprehensive treatment, look for the pedigree of training where the person's trained, as well as the equipment that's being offered.
Because the typical diabetic is only exposed to one thing, getting their insulin injection.
Correct.
That's what we know about diabetes, having your insulin injections and you're good to go, but it's more than that.
It's much more than that.
And this is what we talked about today, how diabetes affects other parts of your body. Thank you, Dr. Kumar, for this insightful information. Thank you for watching The Good Doctor. If you have any thoughts, questions, comments, please leave us your thoughts and comments on our website, tweet us, or leave your comments on our Facebook page. Thanks for watching EasyLiving.com, where you can find anything and everything lifestyle.